To our new series. It's the fine print, taking a closer look at what's on the labels of over-the-counter drugs. Nearly 200,000 people hospitalized each year for misusing them. And this morning we're looking at pain relievers. And our chief medical correspondent, Dr. Narula, is all over this for us because sometimes it can be disguised on the label a little bit. We got to do a little detective work.
Well, how many times have you actually picked up the bottle and looked at the label on the back, that fine print, which you probably need reading glasses for?
Right.
But it's really important because a lot of people think just because it's over the counter, it's safe, it's something you can use every day because you're not getting a prescription for it. But in fact, some of these over the counter meds carry warnings, and it's important to know how to take them. So when you look at the label, the FDA has it very nicely organized into several different sections. The first thing you're going to see is the active drug, and that's going to tell you the name of the drug and really the amount you're getting per dose, so the amount per tablet, for example. Then you're going to see a line that says uses. This is really what it's meant to do. Then warnings. This is what you want to pay attention to. So when to ask your doctor, when to ask your pharmacist, what to avoid doing, for example, driving or taking alcohol with it if you're pregnant or breastfeeding. And then you're going to see a line that says directions. That's going to tell you, for example, how to take it, how often to take it. And then at the bottom, how to store the meds. That comes under other, and also inactive ingredients. That's where you might find those artificial dyes that we sometimes talk about.
I know, but looking for that expiration date is key.
That is key. So many people keep their meds. I know I have them in my cabinet for way too long. So you want to check that. The FDA says if it's been in your medicine cabinet for over 3 years, it's time to throw it out. You want to also make sure the med hasn't been tampered with when you buy it. So check for seals. And then sometimes, Robin, the companies will update their bottles with new ingredients or warnings. So always check for a little flag or banner on the front of the packaging.
Okay. All right. So pain relievers. I didn't know this word. NSAIDs?
NSAIDs.
All right.
Non-steroidal anti-inflammatory drugs.
Is that what that stands for? Okay, let's talk about that because people think of ibuprofen.
Yes, so ibuprofen, Aleve, Motrin, naproxen, very common class used for pain relief, anti-inflammatory effects, and fever reducing. So think back pain, arthritis, menstrual cramps, headache. So this class of medicine carries a few different things you want to pay attention to in terms of warnings. One is stomach issues. So some people will develop stomach irritation, ulcers, nausea, vomiting if they take these drugs for too long or in too high doses. The next one is kidney problems. You can have kidney failure or swelling. And then the big one that a lot of people don't know about is that in 2015, the FDA put a warning on both prescription and over-the-counter drugs that it can lead to increased risk of heart attack and stroke. And this can be for people who have no risk factors for cardiovascular disease, and it can happen within the first few weeks. So this is definitely not something you just want to take forever without being aware of that. It can also raise your blood pressure and lead to heart failure. So really important. Really, these are meant to be taken for 3 to 10 days.
Yeah, because I have high blood pressure and I have to be very careful with the pain reliever. And because you all know, think, oh, it's over the counter.
And you don't tell your doctor that you're even taking it. Yeah, so really important to bring it up.
Acetaminophen. No, I can never say this.
Acetaminophen.
Yeah, thank you. I can never say that right.
Tylenol.
Okay, Tylenol, right.
Right. So this drug we obviously think of also for pain relief and fever reduction. This does not carry the stomach irritation and bleeding risk that we worry about with NSAIDs. The important thing here is that it can cause liver damage if you take too much of it. So the number you want to keep in mind is less than 4,000 milligrams per day. And if you're taking, for example, some cold and flu medicines, those also might have acetaminophen in it. So you just want to check, am I taking that plus Tylenol? How much am I actually getting?
All right. Now, they're keeping us apart here. I feel so
far away from you.
Oh, but thank you for being here.
Thank
Appreciate you as always. This is a great series. And Dr. Narula will be back on Wednesday to tell us about the fine print on over-the-counter decongestants.
Yes, another big one.
I'll work on my vocabulary.